All right, so I've been thinking about doing this for quite some time. Someone just jump in and see what happens. Just try to get some documentation of my journey through whatever this is that I have. In December of 2022, I noticed muscle atrophy in my left hand between my thumb and index finger. Having a history of neck problems with bone spurs, inflammation, degenerative disc, it was thought to be that was the cause. I had a nerve conduction test and surgery was set up. I have a scar right here where a fusion of C4, 5, and 6 was done and a titanium plate was inserted. I asked the doctor repeatedly and he assured me that was the problem. My hand would be fixed. After 3 or 4 months of seeing no progress, no signs of improvement, we did another nerve conduction study using a different doctor who determined I had cubital tunnel syndrome, so I have a scar from that, supposedly compressing the nerve, messing up the function in my hand. At the time, the orthopedic doctor also suggested a nerve transfer, which I did. Here's the scar from that. Good nerves were fused with the bad nerves, the damaged nerves, in hopes of sustaining that muscle while all of the nerve damage healed. A couple months later, I noticed a difference in my right hand. I was told there was no difference, but at my insistence, another nerve conduction test was done just to be sure. This was done on the right hand, and supposedly I had beginning signs of carpal tunnel. No big deal. It was a result of overuse due to limited use of the left hand. But the Dr. Bell did the nerve conduction test the first time. She was doing this third one. She was not happy with the neck surgery I had, told me it had no impact on my hand at all. So we did more testing to make sure that the muscle in the left hand was still viable, at which point I met with a different neurosurgeon, agreed to having a laminectomy of, I believe, C7 and T1, maybe T2. At those visits, I mentioned a problem with my left foot. I had a physical exam in which this doctor looked at my calf muscles and said, with muscles like that, you do not have a muscular disease. This is going to be more compressed nerves in your lower back. Let's work on the neck and hand, then we'll move down. So I had the second neck surgery and scheduled MRIs and testing to see what was going on with my foot. And in mid-March of 24 was when I was told that I had ALS. That diagnosis was confirmed. Yes, I used air quotes. There is no test for ALS. It's a physical examination. I had had blood work for everything else known to man, and everything came back negative, so it must be ALS. That diagnosis was confirmed with UAB and Ochsner's in New Orleans. So we went, after visiting both of those hospitals, Greg and I settled on Ochsner's in New Orleans for my, once again, I'll use quotes, treatment. The treatment I receive at Ochsner's is 2 medications, One is taken twice a day, and one is taken 10 days out of every 28 days. And at best, that can buy me 6 months, slow the progression 6 months. So that was how my journey with ALS began.